everyone, this is Dr. Mohsin. Today I'm going to teach you how to do the arterial blood gas ABGs. First of all, I will explain how this case will come in the exam. So from what we saying that patient has presented in emergency with some difficulty in breathing. Now consultant has asked you to take the blood sample to check the level of blood gases in the patient's blood. So after entering the station, you will take short history regarding difficulty in breathing, when it started, how it started, is there anything specific happened, he has any history of respiratory problem previously. After that, doctors, next you need to explain the patient that why you are here. You need to tell him that I am here because I need to take the blood sample to check the level of blood gases in your blood. Next, you will ask the patient a general short history regarding is he having any diagnosed medical condition, any blood disorders, is he taking any medications, any blood thinners, and is he allergic to any medicine. Next, doctors, you will explain the patient the procedure, that what you are going to do. You will let the patient know that I am going to insert a thin needle into one of your blood vessels to check the level of blood gases. Right, and you will let the patient know that you might feel a sharp scratch, but you will be try to as quick as gentle as possible. And you should explain the patient that normally we take sample from superficial veins, but here we are going to take sample from the deeper blood vessels. Alright, after the position, you need to tell that can you please straighten up your arm, and for the exposure, you will ask the patient to roll up the sleeves if he is very long sleeves. Next, doctors, you need to ask the patient is he having any arm soreness and any arm preference. Next, doctor, you need to collect your equipment. You will move to the table and you will collect your equipment. So what are the things we need for this procedure? We need this ABG bag, we need this cotton, the alcohol swab, and the plaster. So doctor, best thing about ABG's equipment is there is no need to collect lots of things because it will come as a bag. This bag will contain all the things. After taking all the things, we will now open the things, we will prepare our equipment. So first of all, we will prepare the outer packing of alcohol swab. Alright. Next, we open the ABG's bag. Alright, so this ABG bag would be having this stopper, this syringe, and this needle. You simply remove this stopper and apply the needle here like this, alright, and then loosen the cap. So our equipment has been prepared. Next, you will wear the gloves and now start the procedure. Before starting the procedure, you need to tell the patient and that I need to do a test called modified Allen test. So we will explain the patient that patient need to make a fist, and you will be applying pressure on patient's wrist, both on radial side and ulnar side, to check the blood supply in the patient's hand. So there will be actual red light in mannequin as well in your exam. When you will press, red light will gone, and in real patient hand will become pale. So after asking the patient to make a fist, you will simply press on patient radial and ulnar artery, and when there will be no red light, alright, then you will ask the patient to open the fist, and the patient's hand will be pale. Alright, then you will simply take the pressure from the ulnar side and patient hand will become red again. So it means blood supply patient has it intact, because there is risk of damaging the radial artery or blocking the artery. So if ulnar artery is patent, there is no need to worry. Now we can proceed for our procedure. After that, doctors, we need to now start the procedure. So we will simply feel for the pulse here, radial pulse, place 3 fingers, and we will feel the pulse, remove the middle finger like this, take the alcohol swab, clean it with a single stroke, take this needle, hold it like a pen, like this, and insert it in radial artery at 60-degree angle. So this is 90-degree, doctors, this is 45. You need to insert at 60-degree in exam to get the sample. And this is self-filling syringe, there is no need to pull the plunger. So insert, and it's self-filling, sample will start coming when you will be inside the radial artery, and you just need to take 1 ml of the blood. Then after taking the blood, press here, alright, take the needle out, let the patient know that I'm going to take the needle out. After that, ask the patient to press here for 5 to 10 minutes because it's arterial blood and there is risk of massive bleeding. So we need to press for more time. After that, doctors, you need to simply remove this needle, alright. Remove this needle, apply the stopper, and you need to apply that I will able to the patient details and if patient is on any kind of oxygen and oxygen saturation as well, and then I will take the lab by myself because this is arterial sample, it will clot immediately. And then place it in samples, then You need to apply the plaster here. Right. Apply the plaster. On this side we have taken the sample. Then thanks the patient. Let the patient know that I have sent you a sample to check the level of blood gases, and if there is any problem we might need to give you some medications, right? And according to that we'll be treating you. And then let the patient know if he is having any pain, any bleeding or any discharge from this side. We have taken sample. Let us know. We're here to help you. Thank you so much.